बिस्मिल्लाहिर्रहमानिर्रहीम रब्बि शरह ली सदरी व यस्सिर ली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली. I am Dr. Mudassir Shahbaz, Associate Professor, Anatomy, Sahara Medical College. As we are discussing about the thorax, and in the thorax we have been discussing about the anatomy of the heart and surface marking of the heart and the internal features of the atria as well as ventricle of the heart. Now today we are going to discuss about the pericardium. Pericardium of the heart. Pericardium, the fibrous membrane which is surrounding the heart. Here we are seeing pericardium around the heart, in which heart is lying surrounded by pericardium. Now, what is pericardium actually? It's a fibroserous, means that it's a fibrous element and a serous element sac that encloses the heart and root of great vessels. Here we can see this is closing the heart and at the root of great vessels. And we know that this pericardium lies within the middle mediastinum of the chest. So here we see the pericardium, and here is a cut edge of the pericardium. When we enlarge it, we see that the pericardium is two types. One is, here is the fibrous pericardium. It is fibrous in nature. And within it is a layer of serous pericardium. Serous means that the fluid within the pericardial cavity will be produced by this layer, serous pericardium. This serous pericardium, as we can see, has two further types. One is at the one layer which is lying over the surface of the heart, that is visceral pericardium, and other layer which is attached to the fibrous pericardium, that is the parietal pericardium. Between these two layers, parietal and visceral, is the pericardial fluid. So this is pericardium, fibrous pericardium. So what is fibrous pericardium? Here we can see in this diagram that this fibrous pericardium, this blue line, is enclosing whole of the heart, and below it lies over the diaphragm, where it is firmly attached. It cannot be separated. This fibrous pericardium cannot be separated from the central tendon of the diaphragm. And above we see that here the fibrous pericardium is attached to the outer layer of great vessels, aorta and pulmonary trunk, vena cava, and pulmonary veins. Here the fibrous layer of pericardium. Within this fibrous layer is the serous pericardium, having two layers. One is along the fibrous pericardium, that is parietal one, and one is along the surface of the heart, and which is the parietal layer of which is the visceral layer of pericardium. Between parietal and visceral layer is the pericardial cavity. The fibrous pericardium anteriorly may be attached to the sternum by sternopericardial ligament. So this is fibrous pericardium. You can see that if we divide posterior mediastinum, anterior mediastinum, so this pericardium lies within the middle mediastinum. So serous pericardium, here we see that the inner layer of pericardium, the serous pericardium, here one layer is lying along the fibrous pericardium, other layer over the heart, and in between is the pericardial cavity. And the visceral layer, which is lying over the heart, it forms the external layer of the heart valve, that is the epicardium. Inside will be the endocardium. And these two layers, they are continuous at the base of great large vessels. And between them is a pericardial cavity having thin fluid, so that will allow the smooth contraction of the heart within the pericardial cavity. So the pericardium and the pericardial sinuses. Now we will see. First, to understand the pericardial sinuses, we have to understand that firstly, initially, heart is like a tube. It's a heart tube. But during the further development, the folding of the heart, it is the folding of the heart which produces the two sinuses, transverse and pericardial sinus. Here we see that when heart tube folds, it produces a fold between the great vessels of pulmonary trunk and the aorta and the inferior part where it is the here will be the pulmonary veins and this is the atrium, and here thus this folding creates a sinus between the pulmonary artery and aorta and the base of the heart, that is the left atrium, spina vena cava, inferior vena cava, left atrium and pulmonary veins. Here it creates a sinus. So this sinus, because it is lying transversely, so this is called as the transverse sinus. In this diagram we also see primordial heart tube in the pericardial sac, then the primordial transverse pericardial sinus here is developing, and after the folding final position of the heart, the primordial atrial and venous ends of the developing heart are brought together and then forming the transverse sinus. So the outflow, it is basically a sinus between the outflow and inflow of the heart. And the posterior view of the adult heart has been shown here. Now here again we see, this is the pericardium, is showing the pericardium which is lying here, showing the sinuses of the heart basically. And we will now see the two sinuses here. In this diagram we can see the two sinuses, transverse sinus and oblique sinus. So here we see the transverse sinus. In my opinion, that it's not a sinus but a kind of fistula, where the two ends are opening into the pericardial cavity, and it's a sinus lying between the aorta, pulmonary trunk, and here is the left pulmonary artery, right pulmonary artery, and in inflow tract, that is the superior vena cava, pulmonary veins, and inferior vena cava posteriorly, but here mainly the superior vena cava and pulmonary veins, right upper pulmonary vein, here lying the transverse sinus. And here below we can see that inferior vena cava, pulmonary veins, two inferior pulmonary veins. Here the serous pericardium reflects back over to the parietal pericardium, that is the fibrous pericardium, and becomes the parietal pericardium, thus creating a sinus. This we can say a true sinus, between which is one end is opened into the pericardial cavity below and other ends they are closed by the pulmonary. So here is the oblique sinus, because it is lying on the base of the heart obliquely between the left atrium and the fibrous pericardium. So oblique sinus here is shown, that formed by the reflection of the pericardium onto the pulmonary veins of the heart, and it's like a bursa. It acts like a bursa. Here is the reflection. Anteriorly will be the left atrium and posterior will be the parietal pericardium of the fibrous pericardium. Below it will open into the pericardial cavity. Here is the sinus, oblique sinus. So it's, but here if you see, it looked like a fistula, but it is named as the sinus. In the previous slide, if we see, there are other recesses, additional recesses are present between the two layers of the serous pericardium. So here we see post cable, means behind the superior vena cava a recess is formed, which is named a post cable recess. And pulmonary veins, this is also forming a recess between the two pulmonary veins. Here is the pulmonary recesses. In this way, we can say that this oblique sinus is also a big recess, but because here lying it is bigger, it acts like a sinus in which one end is opening into the pericardial cavity. So transverse sinus, here we see, if you pass your finger behind the pulmonary trunk and the aorta, it will come out on the other side. It is passing from the left to the right side. Index finger is passing through the transverse sinus. The benefit of this is that here you can occlude the aorta and pulmonary trunk during the bypass surgery, cardiac surgery. So nerve supply of the pericardium, the fibrous pericardium will be supplied. Here we see the phrenic nerve is running down along the pericardium. So the fibrous pericardium and parietal layer of the serous pericardium will be supplied by the phrenic nerve. And visceral of the serous pericardium, that will be autonomic, means sympathetic and parasympathetic from the vagus nerve. So this is the nerve supply of the pericardium. Here we see fibrous pericardium and the parietal layer of the serous pericardium supplied by the phrenic nerve. Here the phrenic nerve is passing along the pericardium, so it will supply the parietal and layer of the serous pericardium and fibrous pericardium. Phrenic nerve, this course has been discussed already in previous lectures, but here there are two nerves, right phrenic nerve and the left phrenic nerve. The right one is on the right side of the superior vena cava and the heart. The left one descends on the left side of the heart. Both terminate at the diaphragm. And it's basically motor and sensory supply of the diaphragm. But the sensory fiber to the mediastinal pleura and the pericardium, fibrous pericardium, and the parietal layer of sinus pericardium, serous pericardium, they are also supplied by the phrenic nerve. Here we see the blood supply of the pericardium. It's a pericardium, blood supply of the pericardium. So it's internal thoracic artery, branches from the internal thoracic artery. One is the pericardiophrenic artery supplying the pericardium. Here are the other small branches coming from the internal thoracic artery to supply the pericardium. From behind, posteriorly, the branches from the bronchial artery and branches from the esophageal arteries, they are also supplying the pericardium. So this is the arterial supply of the pericardium from internal thoracic, from pericardiophrenic, musculophrenic, inferior phrenic arteries, thoracic aorta. These phrenic arteries, they are branches of the esophageal, also the esophageal and the bronchial branches, they are also supply the pericardium. The venous drainage will be along the internal thoracic vein and superior phrenic veins and the azygous venous system. Now we come to the functions. Keeps the heart in the thoracic cavity. It prevents the overexpanding of the heart when blood volume increases, limits the heart movement, acts as a shock absorber with the help of fluid-filled sac. Okay. Sudden dilatation of the cardiac chamber is prevented by the pericardium. Kinking of the great vessel is also prevented by the pericardium because the fibrous layer of pericardium is attached along the root of great vessels. And influence the ventricular filling means if there is fluid in the pericardial cavity and something is compressing the heart, that will influence the cardiac filling. It can reduce the cardiac filling, coupling pressure and volume on one side of the heart to the pressure and volume on the other side, minimizing friction between the heart and surrounding structure. It also acts as a mechanical barrier to the infection. Now we see pericardial fluid. Its normal value is 10 to 50 ml, which is absorbed and produced continuously, but it remains between the 10 to 50 ml. But if it increases due to some disease process, and then it is become the pericardial effusion. Increase in volume of the pericardial fluid, excessive accumulation, and will produce the pericardial effusion, often caused by the viral infection, most common by the enterovirus. Now, the disease of the pericardium may present clinically by the inflammation, acute or recurrent pericarditis, can present with the accumulation of the fluid in the pericardial cavity, so causing the pericardial effusion. It may cause the cardiac tamponade, and if the pericardium become fibrous and constricted, then it is called as constrictive pericarditis. The term of myopericarditis and perimyocarditis is used for cause of the epi that also demonstrate the myocardial inflammation, acute pericarditis. So here this slide shows that if you develop pericardial effusion, so how can you take the sample of pericardial fluid, which is called as pericardiocentesis. So you see here the fluid is taken from from the pericardial cavity. Here the normal pericardial cavity, here the fluid in the pericardial cavity, which is causing the tamponade of the heart, increase in the pericardial fluid, pericardial effusion causing. Here you can see the heart is compressed from all the sides, and so the capacity of the ventricular filling and flow of the blood through the heart is limited by this pericardial effusion, called as pericardial tamponade. Here in this diagram, you see the pressure from outside is exerted over the chambers of the heart, so causing compression of the chambers of the heart, limiting the blood flow through the chambers of the heart. So pulsus paradox is one of the signs, which is by the Kussmaul in 1873, that the radial pulse during inspiration becomes absent or reduced in the case of pericardial effusion, and this is called as pulsus paradoxus. This is a key diagnostic factor in the pericardial effusion, cardiac tamponade. This way, here you see below the xiphisternum, at an angle of 45 degree, a needle is pushed towards the left side, towards the left shoulder, you can say, or left midclavian, and the needle then enters into the pericardial cavity. Then you can suck the pericardial effusion for the diagnostic purpose. Other thing I want to show you is the cardiopulmonary bypass. During this cardiopulmonary bypass, actually, the heart is separated from the rest of the body and placed. The rest of the body is dependent on this machine, that is the perfusion machine, in which the blood from the whole of the body is taken into this machine, and then it's become oxygenated and other waste products are taken out, and then again through this aortic uh, channel it is then again pushed back into the heart, into the body. So keeping the perfusion of the whole of the body. So this machine, cardiopulmonary bypass machine, is performing the whole function of the that function of the heart, and heart itself is can be uh, clamped between here. I have shown you this sinus. Here in this level, the aorta and the pulmonary trunk can be clamped, and then the heart is connected to the left right atrium for the um, whole body venous drainage has come to the right atrium. So it is through this channel that is blood is taken to the machine, and here put a cannula, aortic cannula, through which the heart blood is then pushed again into whole of the body. So this was a cardiopulmonary bypass. Sympathetic fibers, they terminate the SA and AV node, cardiac muscles. The autonomic nerve supply comes through the cardiac plexus. Situated below the arch of aorta, sympathetic supply arises from the cervical and upper thoracic portion of the sympathetic trunk, and parasympathetic comes from the vagus nerve. And they act through the SA and AV node. You can see. So this is all about the pericardium, and now we can see, and inshallah in further lectures we will discuss other conducting system and arterial supply of the heart. Thank you. Allah.